All right. So today we're talking about C Difficile, and that's actually a diarrhea, bacterial diarrhea infection, and your patients should be on contact precautions. The nurse should let you know, she should put in there contact precautions, and contact precautions is two things: the gown and the gloves. Okay? There's a lot of information in this pamphlet about C Difficile, and I was just really surprised by some of the information. My name's Renee, by the way, one of the RNs here. I'm glad to see everybody here. I know some of you are new. So let's just jump right in. I gave you the quiz. We'll be looking at this. We'll be going over it together after. You can look at some of the questions now. They're kind of tricky. Like number 4 is tricky. Many people carry C difficile in their bodies without getting sick. We'll find out. We'll find out, won't we? Okay, let's go ahead and review this paper with me. So let's talk about Steve. Steve is a certified nursing assistant at a long-term care skilled facility. The residents love him and he's good at his job, but sometimes he cuts corners with infection control, especially when he's in a hurry. One busy day, his favorite resident, Mrs. H, had some watery diarrhea and a few drops of feces got on her sheets. Steve dashes into the room to change the bed without taking time to wear gloves. What Steve does not know, and to see, this is me. It could be any of us, right? Mm-hmm. Yeah, because sometimes we forget or we're in a hurry, but don't do that. Don't skip it. What Steve does not know is that Mrs. H's diarrhea is being caused by a bacteria called Clostridium difficile or C. diff. Some of these C. diff spores are on the sheets, and as Steve folds up the dirty linens, he gets the spores on his hands. So you think maybe let's just put some alcohol gel on and we're good, right? No, not with C. diff. We learned today you have to wash your hands with soap and water to get that off your hands. And what if you already touched your pen? What if you already touched your cell phone or the table? It's already transferred. There's bacteria spores that can transfer, and they can live for weeks on stuff. That's why we have you put that paper gown on and the gloves on. And don't bring your pen, don't bring your notebook or your paper into the room. Leave that outside. Just go in, do the bath. Don't bring anything with you because you don't want to get those spores, those bacteria on your pen or your stuff, okay? So what happens with Steve next? Okay, after he finishes up with Mrs. H, he takes a 5-minute break to gobble down a sandwich he brought for lunch. Unfortunately, he does not wash his hands before eating. He just uses some hand sanitizer. The C. diff spores spread from his hands to his sandwich and into his mouth. And the bacteria has found a new home. Yes, after his quick lunch, Steve does a vital check on 3 different residents because he still has not washed his hands. He only used the alcohol gel. I'm guilty of that, okay? He spreads the C. diff spores to all 3 patients. He also spreads spores to everything he's touched, including the doorknobs, the electronic vital sign machine, and the pen he borrowed from the coworker. Come on in and grab a seat. In the upcoming days, the C. diff bugs in Steve's GI tract have set up camp. So this is in him, in his stomach, in his intestines. The C. diff bugs have set up camp and start multiplying. And that's why we say he is colonized. He has become colonized with C. diff. Okay, some people are actually sick with C. diff, Other people are colonized, okay? Steve shows no signs of infection. Why? It's because he is a healthy guy and all the good bacteria in his intestinal tract are able to show the C. diff who is boss, okay? So he's colonized, he can spread it. It's like he's got the bacteria in him, it's not actually making him sick, but it will make the other people sick, okay? Unfortunately, one of the residents isn't so lucky. Steve spread the C. diff spores to Mr. Smith when he took his vital signs because Mr. Smith was taking antibiotics. Many of the healthy bacteria in his intestinal tract have died. So that's one of the reasons somebody with C. diff, they were just on antibiotics, and that killed off the good bacteria in your gut. We've got good bacteria, but the antibiotics kills everything. So that's why when people take antibiotics, they'll get a rash, a yeast rash somewhere, maybe on their tongue. They'll also can get C. diff because the good bacteria that fights the C. diff is also killed from the antibiotics. So that's why when you go to the doctor for just any old thing, you know, you want to make sure that you really need the antibiotic. A lot of times the doctor won't give you antibiotics because he says, well, let's just give it a few days, or this is really not a bacteria, this is really a virus, and you're thinking, why did I even come? But there is a good reason not to take antibiotics because the doctors have been over prescribing antibiotics and killing off our good bacteria, and it's important for us to keep the good bacteria strong. Okay, so, all right, let's turn the page. Let's learn more about C. diff, okay? Turn on the other page where it says facts about C. diff on the back. Okay, is C. difficile really worth fussing about? Yes. It's a bacteria that is having a major impact on healthcare. These tiny bacteria are costing our healthcare system almost $4 billion a year. Okay? The second bullet, even worse. Every year, at least 500,000 people develop C. difficile infections. About 30,000 of them die. So this is actually on your test. It's question number 1. So the question says every year up to 30,000 people are infected with C. difficile. That's false because they're saying 500,000 are infected and 30,000 of them die. So question number 1 is false. Okay? All right, make sure you put your name on your test. So we'll turn those in. Okay, and then it says there's no way to wipe out C. difficile bacteria because they live all around our environment, in the soil, air, water, and in animal and human feces. Let's see. C. diff bugs are passed in feces, bowel movements, and when people don't wash their hands regularly and properly, they spread the bacteria to everything they touch, including food and surfaces and objects. You cannot get C. diff off of your hands by using alcohol-based sanitizer. Even when I go in sometimes to see some of my patients and they've got that bedside table and I think, let me put my stuff here, let me chart with my computer. Last time I just got a chuck out and put it on top, you know. But a lot of times I'll take something and wipe. But even their little, you know, the skin wipes, it's not the right thing to clean that table. You know, we have to have, you can have a barrier, yes, if you're going to put your stuff on it. If it's their stuff, it's okay. If it's their bath basin and stuff.
Can't we use the cavi wipe?
Yes, the cavi wipes are the right thing to use. They will kill the C. diff bacteria. Yeah, the cavi wipes. Okay, let's see. Now the next bullet is very interesting. Unfortunately, C. diff spores can survive for weeks or even months. So that means in healthcare facilities like boarding cares or assisted livings, the spores are spread to patients most often by the hands of the healthcare workers who have touched a contaminated surface or item. The spores can also spread through the air. For example, spores may shake loose from dirty linens and float in the air. That's scary, isn't it?
Yeah.
That's very scary. Yeah. And contact precautions, I just looked up on the next page or so, is only the gloves and the paper gown. So don't shake the stuff into the air. That'd be bad, wouldn't it? Okay, so the C. diff bacteria can live and multiply without oxygen, making it the perfect bacteria to camp out in the large intestine. And the next one says most people like Steve, the CNA, become colonized with the C. diff bacteria without getting sick. So it's interesting because we have a higher chance of carrying the C. diff, but we don't, we wouldn't know it because we're not having the symptoms.
So number 4 is true.
Number 4, you're right. Number 4, that's good, thank you. So go to your question, number 4 must be true. That's right. Many people carry C. diff without getting sick. Thank you. Feel free to jump in, Luana. Okay, good. Let's see what's next. Right, and then just what I said in the next one. The percentage of people who carry in the hospitals, nursing homes, long-term care facilities, the percentage of people who carry the bacteria is much higher because it's the people like us. And then they say that scientists have identified a relatively new strain of C. diff, and it makes it harder to get rid of. It's resistant. Yeah. Okay. Let's turn the page over. Okay. Let's see. A lot of this is. It's a lot of stuff. Okay. A lot of stuff. In the past, as many as 80% of the cases of C. diff were associated with hospitals, but today, it's different today. This potentially deadly epidemic is spreading to doctors' offices, clinics, and other healthcare facilities. So it's increasing outside the healthcare environment. Okay. Oh, and the 4th bullet down. Today, almost half of all C. diff infections occur in people younger than 65, but more than 90% of the deaths involve people 65 and over. So I think that's number 3. People over 65 are 10 times more likely to develop C. diff. And the answer is, wait a minute, hold on. I think actually it's true.
True?
Yeah.
Almost.
Number 2, right. Number 2 is false. We just talked about that. Right. The C. diff infections occur only in hospitals because hospital patients are sicker than other people. No, that's not true.
Higher, but not limited to.
Right, exactly. It's coming more in nursing homes and people in the doctor's office. Okay. All right. Let's see. So let's go to. Oh, look at the last bullet on this page, the score of the problem. A 2012 study found that hospital food is frequently contaminated with C. diff. I know, it makes me so upset. Researchers found that about 1/4 of the food samples they tested were positive for C. diff.
Wow.
Isn't that awful? Oh my gosh. More research is needed to know if C. diff can be spread via food. So it seems like they already know that. Yeah. Okay. Let's turn the page because we're going to find out more. Okay, so These are is your client at risk, okay? These are some of the key things that you can figure out if you're high risk, or if your patient or your mother or your father is high risk. Is your client currently in the hospital or back from a recent hospitalization? At least 1 out of every 5 hospital patients has C. diff in their body. The risk increases if a hospital stay is lengthy. The studies show that hospital patients who acquire C. diff triple their risk of dying while hospitalized. Isn't that horrible? It's awful. We don't like this disease. It causes watery diarrhea and dehydration, and then that's just a cascade. The rest is, if they can't get that diarrhea under control, you're just history, right? Does your client live in a nursing home? Up to 50% of residents in long-term care facilities test positive for C. diff in their feces, although many do not have diarrhea or other symptoms. Exposure to these carriers, the people who are calling them carriers, significantly increases a person's risk of becoming infected. Has your client taken antibiotics recently? Certain antibiotics, called broad-spectrum antibiotics, increase the risk of becoming infected with C. diff. The risk goes even higher if someone takes multiple antibiotics or has been on antibiotic therapy for a long time. Researchers believe that 90% of C. diff infections occur in people who recently took antibiotics. Is your client at least 65 years old? They're 10 times more likely to become infected if they're over 65 or 65 or older. For some reason, statistics show that women make up 60% of C. diff cases. Does your client have a serious underlying medical condition? People with a weakened immune system because of an illness or a treatment like chemotherapy are at risk of becoming infected with C. diff, especially during a hospital stay. Has your client ever had C. diff before? People who have been treated recently for C. diff have a 25% chance of becoming infected again within 8 to 10 weeks, either because the treatment didn't get control of the C. diff bacteria or a different strain of the bacteria causes infection. Once a person has had C. diff twice, their chances for more infection jumps to 60%. Has your patient or client had gastrointestinal surgery? Gastrointestinal surgery increases the risk. That's not a good, that's a typo. Increases the risk for C. diff in a number of ways. Most people are given antibiotics immediately before and after surgery. Secondly, because the person doesn't eat a regular diet for some time after surgery and the colon is inactive with nothing flushing it out. Okay, and then there's bowel disease, inflammatory disease. Does your client take medications for heartburn? That's a scary thing. If you're taking Prilosec, you maybe have triple the risk for developing C. diff. Who knew, right? I didn't know that. Did your client just had a baby? There's evidence that postpartum women have a greater chance of contracting C. diff. Okay, turn the page. We're going to look at the symptoms. Okay, so remember that people in good health usually do not get sick from C. diff. They are colonized. Your gut is colonized with the C. diff bacteria, but you don't have to be sick. You just spread it to other people. Okay, let's see. However, let's say a healthy person has C. diff in her system but no symptoms, then she develops a UTI, and her physician prescribes an antibiotic. Along with killing the germs causing the UTI, the antibiotics destroy some of the good bacteria in her intestines. Without an army of healthy bacteria to fight them off, the C. diff germs quickly grow out of control. They produce a toxin that destroys cells and creates patches of inflammation inside the colon. That toxin can create the following symptoms: abdominal tenderness, pain and cramping, frequent watery diarrhea at least 3 times per day, mucus in the stool. In more severe cases of C. diff infection, there are additional signs and symptoms such as fever, nausea, dehydration, loss of appetite, weight loss, more severe abdominal cramping and pain, more frequent diarrhea up to 20 times per day, pus or blood in the stool. And this little 14-year-old girl who had the C. diff infection, she said it was so painful she couldn't think. She couldn't keep track of what she was saying. She couldn't move. She wished it would be over and she could just die. Must be pretty bad. Okay. All right, keep in mind that most C. diff symptoms occur in clients who are taking antibiotic medications. Let me wait for that train. However, it is not unusual for symptoms to appear up to 10 weeks after the person has stopped taking the antibiotic. So, 10 weeks, up to 10 weeks, wow. For 25% of people with C. diff, the infection is fairly mild. Once they stop taking the antibiotic that caused the C. diff, their symptoms resolve within a couple of days. C. diff infection can be fatal. The risk of life-threatening condition is higher among very elderly patients as well as individuals with existing health conditions. Okay, and we already said about 1 out of every 4 people with C. diff get the infection again. This is true for people who are elderly or weakened. Okay. All right, you turn the page. Just going to give you a picture of the gut. Yeah. That's just pictures of the gut, and these little spores are pus-filled nodules. These toxins can cause ulcers, perforation where it just kind of rips open, and that's bad. That can kill people. So what question have we answered? Let's see. Number 5?
Number 5 is,
Did we talk about that? Wait a minute, let's keep going.
Yes, we just did it.
That's what it,
Number 5?
Yeah.
yeah, we did, because of the, we just stopped.
Okay, well, let's talk about the complications. Let's go to this, make sure we get it right. Let's read this real quick. We've got time. The symptoms of C. diff infection, diarrhea, abdominal pain, fever, and nausea are bad enough. Unfortunately, there are complications that can spring from the C. diff infection that make the situation worse, especially if your client is elderly or has other serious medical conditions. These complications of C. diff include dehydration, which it says some people infected with the C. diff suffer from severe dehydration. Elderly people are especially prone to this condition. If the body becomes severely dehydrated, the person's blood pressure can drop to dangerously low levels. Clients who are experiencing frequent watery diarrhea are at risk for dehydration. So here are the signs of dehydration. We've got dry mouth, dry skin, lightheadedness, sunken eyes, rapid pulse, urinating less than 3 times a day, and fainting. So I think this one's number 7.
Yeah.
Yes.
So that would be, oh yeah, not frequent urination, not slow pulse, fast pulse, not increased sweating. Number C is correct. So 7 is, circle the letter C. Sunken eyes is the symptom of severe dehydration. 7 is C. Okay. Then, if the dehydration worsens suddenly, it can cause a rapid deterioration of the kidney function, leading to kidney failure. When a severe C. diff infection causes the intestine to widen or inflate rapidly, this person is said to have a toxic megacolon. That's a life-threatening condition. The perforated colon. Sometimes the C. diff bacteria causes so much damage to the lining of the intestine it can create a hole in the colon. This can be a life-threatening condition called peritonitis. Sepsis is another potentially life-threatening complication. Sepsis can happen to anyone, but it's most common and most dangerous in the elderly or people with a weakened immune system. Sepsis develops when the immune system goes into overdrive in an effort to fight an infection. The immune system releases infection-fighting chemicals into the bloodstream, and those chemicals trigger inflammation throughout the body. This inflammation can cause organ damage by blocking the flow of nutrients and oxygen, and without the oxygen, the organs begin to fail. In the worst case, sepsis leads to a life-threatening drop in blood pressure called septic shock. Clients go into septic shock and can quickly lose function in their lungs, kidney, and liver, causing death. So a lot of people can get sick and die from this, the elderly. There is another question though. Number 6. Okay. Sepsis is a complication of C. diff infection that is caused by dehydration. That's true, isn't it? 6. Wait a minute. Why are they saying that? They're saying it's false. Let me tell you why. Because,
Dehydration?
right, because it's not caused by dehydration. That's right, because it's not, sepsis is a complication of C. diff, but it's not caused by dehydration. Sepsis develops when the immune system goes into overdrive in an effort to fight the C. diff. And then there's infection-fighting chemicals that trigger inflammation. So that's right. 6 is false. Okay. Okay, now 8. What's the answer to number 8, y'all? Okay. C. diff spores are resistant to alcohol-based sanitizers. That means that's true because it does not kill the spores. And number 9, did we talk about what to do, what we do? No, we haven't got there yet. My goodness, this is a lot of stuff.
By shaking your gloves and shaking stuff in airborne.
Go to page 10. Go to page 10, we're going to talk about contact precautions. What did we say contact precautions is? 2 things, the gloves and the gown. Put it on just before you enter the client's room. Okay? Change your gloves during client care, especially after contact with highly contaminated items. Remove the gown right before leaving the area. Place used gowns in especially marked biohazard laundry or trash. Take your gloves off right before you leave the client's room or home. Be careful not to touch contaminated items on your way out, and wash your hands immediately. Do not take a pen, a stethoscope, a sweater, a cell phone into the area of the client with contact precautions. This will prevent you from carrying the disease to your home or to the community. Disinfect any client care equipment used on a client with a contact infection. And you can use the cavity wipes. Okay. Let's look and see, are we missing anything? Preventing. Oh, the cleaning. Look at page 9. So how can we prevent C. diff? We want to, the doctors can help prevent C. diff by only prescribing the antibiotics when it's absolutely necessary. If your client is taking antibiotics, report change in bowel habits right away, because they do take Flagyl, which is another antibiotic, an antifungal, which is the only treatment actually right now for C. diff, and they must take that medication for a long time. So hand hygiene, don't cut corners when it comes to infection control. Wash your hands before working with each client. Use gloves during client care, and after removing your gloves, wash your hands with soap and water. The C. diff spores are resistant to alcohol. That means alcohol-based hand sanitizers may not kill the C. diff, right? Wash your hands. Oh, and artificial fingernails are impossible to clean thoroughly. Even with an antimicrobial soap and vigorous scrubbing, if you have artificial fingernails, you may be carrying C. diff bacteria around with you as you care for clients and go to your home to your family. Okay. Let's see. It's probably good to use, it's good to use hand washing before and after each patient. And it doesn't have to be hot water. It can be cold water. In the facility, when you're cleaning up, you want to use the EPA registered disinfectant that's sporicidal. So we'll have to check ours, I guess it is. And if you work in somebody's home or your own home, you can mix a half a cup of chlorine bleach to 1 quart of water and use this. Leave it on the surface for 10 minutes before you wipe it off. Amazing, isn't it? Amazing. Yeah. And make sure that the visitors follow the necessary infection control precautions. Have them, show them where they can wash their hands before and after. Encourage visitors not to sit on the patient's bed. Yeah. Okay. All right, let's see. Let's look at some final tips on page 11. So this is going to be the hard part, is telling your patients, encouraging them to ask you and your coworkers, have you washed your hands prior to starting the care? And if they do ask you, don't take it as an insult. It means your clients are doing their part to stop the spread of common infections like C. diff. During treatment for C. diff, remind your clients to take each dose of their medication on time and finish the entire course of treatment, usually 10 to 14 days. Help clients with C. diff avoid dehydration by encouraging them to drink adequate fluids because they are having the diarrhea. And let's see, observe the color of the urine and how frequently your client urinates. When a person is well hydrated, the urine is colorless or light yellow. And they urinate every 3 to 5 hours. If you notice infrequent urination or urine that is dark yellow, your client may be dehydrated. A lot of our people are, because they just won't drink. Maybe they have swallowing trouble, or they're just, a lot of older people, they just don't, Okay, so seek immediate help or call your supervisor if a client with C. diff has a fever and stomach cramps that get worse or do not go away, has a swollen or hard abdomen, has black or bright red stools, vomits blood, is short of breath or complains of feeling faint. And then we talked about the signs of the dehydration, which we decided. Okay. All right. And then there's always the brat diet for diarrhea: bananas, rice, applesauce, and toast. That's supposed to slow down the diarrhea. Okay. So let's look at the questions and make sure we got each one of them answered. Okay, number 1 should be false. Number 2 should be false. That's right, because it's becoming more common to have C. diff outside of the hospital. Number 3, true. Almost half of all C. diff infections occur in people younger, but the risk increases tenfold after 65. C. diff infection. That's the tricky part of number 3. C. diff infection. Okay, anyway, let's move to number 4. People in good health don't usually get sick from C. diff. That's true, okay? I didn't see the answer to number 5 anywhere.
I guess it's
Think
B.
it's there.
B, we can see,
Spread to the
spread to
lungs.
lungs.
Then they shut the organs down?
You're right, the lungs.
It's on page 5.
It's on page 5? Okay, thank you. Because I didn't see where that
It didn't
was.
say it did, but it says
Oh.
destroy, damage, walls, release toxins.
Okay.
Only thing it didn't say was spread to lungs.
Okay, so the answer to number 5 is, letter B. The C. diff bacteria can do all of the following: release toxins, destroy cells, damage intestine walls, but it does not spread to the lungs, thank God. Right?
Not
Yeah.
yet.
Not yet, yeah. Number 6, we already got. Sepsis is a complication of C. diff infection that is caused by dehydration. That's false, because sepsis is caused by, let me read it. Immune system goes into overdrive. That's it. The immune system goes into overdrive is why we get sepsis. Number 7, symptoms of severe dehydration might include C, sunken eyes. It's not, it's gonna be infrequent urination, rapid pulse, and no sweating. So it's C, number 7. And number 8 is true. C. diff spores are resistant to alcohol-based sanitizers. That's true. Number 9, okay, that's a tricky one. If a client is diagnosed with C. diff infection, he will be placed on airborne precautions. It's supposed to be contact, so it's false. Number 9 is false. Number 10, C. diff spores can survive for a long time outside of the body. That's true. And they can survive for weeks or months on objects, equipments, and surfaces. Okay? So you got it all right. Put your name, and today is 9/8/16. And turn it over and do the evaluation. And my name is Renee. You don't put my name there. Put your name there. They'll know who did the in-service. Thanks.